Welcome to our educational video on lens subluxation, a fascinating yet potentially serious condition affecting the eye. In this video, we'll explore what lens subluxation is, its causes, how it affects your vision, and the available treatment options. Join us as we delve into the world of ophthalmology and shed light on this important topic. So, what exactly causes lens subluxation? The primary culprit is often trauma to the eye. A direct blow can damage the zonules, those delicate fibers that hold the lens in place. However, it's not just accidents that are to blame. Certain genetic conditions, such as Marfan syndrome, homocystinuria, and Ehlers-Danlos syndrome, weaken the zonules, predisposing individuals to lens subluxation. Less common causes include hypermature cataracts, pseudoexfoliation syndrome, and even certain types of tumors within the eye. To understand lens subluxation, we need to discuss the anatomy of the eye. The lens, normally perfectly positioned behind the pupil, focuses light onto the retina. This focusing power relies on the zonules, which act like tiny suspension cables, attaching the lens to the ciliary body. When these zonules weaken or break, the lens shifts from its normal position. This displacement disrupts the proper focusing of light, leading to various visual problems. Depending on the degree of subluxation, the lens may partially dislocate or even completely dislocate into the anterior or posterior chamber of the eye, further compounding the issues. Unfortunately, precise epidemiological data on lens subluxation is limited. However, we know that traumatic lens subluxation is more common in younger individuals due to their higher risk of eye injuries. In contrast, subluxation related to genetic conditions typically presents earlier in life. The prevalence of inherited conditions like Marfan syndrome, which are known risk factors for lens subluxation, varies across different populations, impacting the overall incidence of lens subluxation. The signs and symptoms of lens subluxation can vary widely depending on the severity of the displacement. Common symptoms include blurred vision, double vision, glare or halos around lights, and a noticeable change in refractive error, often requiring frequent adjustments to your glasses prescription. In some cases, patients may even experience monocular diplopia, seeing double in one eye only. More severe subluxation can lead to complications such as glaucoma, if the lens blocks fluid drainage from the eye, or uveitis, inflammation inside the eye. Diagnosing lens subluxation involves a comprehensive eye examination by an ophthalmologist. This includes assessing your visual acuity, measuring your refractive error, and carefully examining the lens and surrounding structures using a slit lamp microscope. The slit lamp allows the doctor to visualize the position of the lens, assess the integrity of the zonules, and identify any associated complications like glaucoma or uveitis. In some cases, imaging techniques such as ultrasound biomicroscopy or optical coherence tomography may be used to further evaluate the position and stability of the lens. While there aren't strictly defined types of lens subluxation, we can classify it based on the degree of displacement and the direction in which the lens shifts. The subluxation can be minimal, with only a slight decentration of the lens, or severe, involving a complete dislocation. The lens may dislocate upwards, downwards nasally, temporally, or even into the anterior or posterior chamber of the eye. This classification helps guide treatment decisions and predict potential complications. The management of lens subluxation depends on the severity of the displacement, the presence of symptoms, and the overall health of the eye. In mild cases, where vision is only slightly affected, and there are no complications, observation with regular eye exams may be sufficient. However, if the subluxation is causing significant visual impairment, glaucoma, or other complications, surgical intervention is often necessary. Surgical options include lens repositioning, where the lens is carefully moved back into its correct position and secured with sutures, or lens extraction, where the dislocated lens is removed entirely and replaced with an artificial lens implant. The choice of surgical technique depends on the individual case and the surgeon's expertise. While we cannot completely prevent lens subluxation in cases caused by genetic disorders, there are steps we can take to minimize the risk. Protective eyewear during sports and other activities that carry a risk of eye trauma is crucial. Early diagnosis and management of underlying conditions like Marfan syndrome can also help to prevent or delay lens subluxation. Regular eye exams are also key for early detection, allowing for prompt intervention and minimizing potential complications. The prognosis for patients with lens subluxation varies depending on the underlying cause, the severity of the displacement, and the presence of any associated complications. With appropriate management, including surgery when necessary, many patients can achieve good visual outcomes and maintain a good quality of life. Recent advances in surgical techniques and lens implant technology have further improved the prognosis for individuals with lens subluxation. Ongoing research is focused on developing new strategies to strengthen the zonules and prevent lens subluxation in individuals with genetic predispositions.